Hello and welcome. My name is Dr. Tom McAbobby, and I'm the Program Director here for the Mercy Health St. Elizabeth Boardman Family Medicine Residency Program. I'd like to welcome you and take this time to talk to you about our wonderful program here in Northeast Ohio. Our program is community-focused with an emphasis on suburban to rural medicine. Our residency program is fully accredited by the ACGME. We take 6 residents per year, and we also sponsor a hospice and palliative medicine fellowship. We provide our residents with a high-functioning and exciting clinical environment. We think it's important for our residents to have exceptional clinical exposures in the outpatient setting, inpatient setting, as well as patients' homes, nursing homes, and community health events. Our clinical experiences are based primarily here at Boardman Primary Care. Our residents also do rotations at Akron Children's Mahoning Valley, which is located about 3 miles from campus. Other outpatient facilities that we utilize include physician offices, nursing homes, and other community outreach points. We're also excited to share that we have a rural pathway. A rural pathway is an optional track for outpatient care that occurs in our Columbiana, Ohio primary care office. This gives a little different flavor to delivering effective outpatient care.
Hello, I'm Sumira Koirala, one of the core faculty members. Here in our residency program, we recognize that teaching is an intrinsic part of being a physician. The meaning of the word doctor in Latin is to teach. To teach is to learn twice. The ACGME recommends that the senior residents serve in supervisory roles during their training. It has been proven in studies that the residents who are more successful and are higher rated as teachers are better in knowledge acquisition, communication skills, and have higher patient care outcomes. So if you're looking for exceptional teaching and friendly environment, this is the right place for you.
Hi, I'm Dr. Sabrina Talbert, and I'm an intern at the Family Medicine Residency Program at St. Elizabeth Boardman Hospital. When I first visited the Family Medicine Residency Program at St. Elizabeth Boardman Hospital as a student, I immediately felt comfortable and I felt welcome. That's mostly a testament to the current residents' passion for teaching students, but it also speaks to their friendship as a whole. So, as a resident here, you are not just peers, you're not just colleagues, but you're more friends. Not only do we enjoy the time we spend together in the clinic or in the hospital, but we also have an active group chat, from getting a group together to go to the fair, or from grabbing drinks or dinner after work, or even organizing a breakfast potluck where we each bring in our favorite breakfast dish to didactics. It's important that we enjoy spending time together and that we have fun as a residency. The support the residents give each other and the support from the faculty here is top tier. It was important to me to choose a program that's going to provide me with a challenging but also supporting learning environment, and that's exactly what you get here at St. Elizabeth Boardman Family Medicine Residency.
We can offer our residents multiple selectives and elective rotations that help shape their clinical and educational experiences here with us. Our educational activities are focused on your academic success as well. Our residents go through board review every day as a part of our morning report. We emphasize success on board passage by providing our residents an opportunity to attend a board review course prior to them taking the American Board of Family Medicine examination.
So one thing I've always liked about this program is that whenever I'm working with the attendings, I don't feel like I'm working under them, I feel like I'm working with them. And so they'll ask you questions, but they won't do it to lower your status or make you feel inferior. They want to actually help you learn and help you gain that knowledge, so that way patient care is the best it can be. Being in this program, I felt like, I had the proper amount of, care at the beginning, where there's some hand-holding and a lot of autonomy at the same time. I feel like I can make decisions for myself, but also have that backup to make sure those decisions were safe and effective. Having grown up here my whole life, I feel like there's a lot more than meets the eye. A lot of different areas to go explore. Mill Creek Park, Yellowstone Park in Struthers. Another thing about Youngstown that I really love is it's right in the center of 2 major cities. So if you head out east, you'll get to Pittsburgh. There's a lot of different restaurants, a lot of different venues to try. And if you head out west, you'll get to Cleveland, where there's a lake, a lot of different restaurants, Playhouse Square, maybe catch a Browns game.
So Rural Pathway is a supplemental opportunity for St. Elizabeth Family Medicine residents where they can come out to a more rural location, a rural serving office, and get some experience with patients who come from rural places. Rural people have their own healthcare needs, healthcare disparities, rural culture. And so that makes a big difference at times when we're having discussions about healthcare decisions and people's values. And even in urban places, to get in to see specialist physicians, it can be weeks and months of wait. Family physicians are trained to do, I would argue, 90% of general medical care. And so we want to try to emphasize a full scope of practice where we're providing general chronic condition management, acute care concerns, women's health with gynecologic care. We do some prenatal care in our residency program. We can do procedures in the office, including joint injections, dermatologic procedures, skin biopsies, and just making sure that that happens throughout a typical day is a goal of the rural pathway, rather than making it special where you have to set aside dedicated time to do those things.
Community outreach is an important part of our residency training. Our residents learn not only the medical knowledge, but also learn how to serve the communities in which they are practicing. Our residents participate in activities like Community Free Clinic, sports physicals in several school districts. Graduates from our program we consider to be pluripotential. Our graduates have gone on to do tremendous things in various communities, including our own. Our graduates have gone on to do fellowship, they've gone on to become hospitalists, they function in the traditional outpatient-only family medicine setting, and most of our graduates do take with them some ability to balance inpatient and outpatient medicine needs. So in conclusion, we feel that our program provides an exciting and dynamic environment for you to become the best version of yourself as a family physician. The combination of exceptional clinical opportunities as well as strong structured educational activities put themselves together to allow any resident to become an exceptional family medicine physician.